Hello, welcome to Foreignness Journey. If you haven't yet subscribed, please subscribe. I'm going to talk about anything foreignness go through. And today I thought we should talk about head to toe assessment. But because it's vast, it's long, I'm going to be breaking it down in parts. So today I'll focus on the just neuro assessment. And one thing you should know, assessment is something you use on every single day. Actually, we actually use it in every single interactions, even outside work. This will help support your clinical judgment and the team, the doctors, the nurses, the preceptors, the charge nurse, and your fellow nurses will trust you if you can make good clinical assessments. That will prove that you can make actually good judgment. And assessment ties into everything. It ties into your ability to give medication. It ties into your ability to accelerate care and to when to call the doctor, to use the ESPA. So you really have to know how to do assessment, and you can never ever perform without doing an assessment on a patient. The neuro assessment will give you a basic view on how your shift will be with that patient. Because the time you're going to a patient, you're able to tell whether the patient is awake, drowsy, or lethargic or unresponsive. This is something you can easily tell when you go into somebody's room. Are they awake? Are they alert to your coming into the room? Did they see you come in? And are they drowsy? Are they sleepy? Are they confused? So those are things you can easily go in. So when you go in alert and oriented, you ask them their name. You ask them what brought them to the hospital. You ask them what time is it. You ask them where you are. Where are you? Because they should be able to tell you, my name is Mary. I'm 72 years old. I'm in Mediterranean Hospital. I came because I was short of breath. And I know the time is 10, and 10 is usually the time I take my medication. Then you know that they are late oriented times 4. And that's what we want them to be at. They should be able to know who they are. And if they just know who they are, that's alert times oriented times 1. They just know who they are. Times 2, they either know their name and where they are. Times 3, they know their name, where they are, and what brought them there. Times 4, they know their name, what brought them there, the time, and their situation. And there's also, apart from being alert, they can be lethargic, where they're sleepy but you can easily wake them up. Or they're obtunded. Obtunded is when somebody is really hard to wake up. You know that's an issue. Or they're unresponsive. And any red flag, any change in these, if they were scoring alert oriented times so, then something changes. It's a really red flag. And any form of confusion to somebody who was alert in this country, it's taken serious until it's proven otherwise. New confusion, it's urgent. And people should be able to tell that you can make a clinical judgment and decision on that. Then speech. When you're talking to somebody, you can tell that you're telling them something and they're answering something that you're not saying, or they're just staring at you, not looking at you. And as a foreignness, for you to be confident, you don't need fancy phrases. Use the same words that you're comfortable in. And one thing I should be able to tell you is you'll be constantly changing your words. And most of us were British English trained. American English is so different, and it means a lot of things differently. What you mean to say and how they pronounce it will be an issue too. So stick to the simple phrases. Any slurred speech, if their speech was clear or slurred or logical or confused, or the agitated, calm, and withdrawn. All those should be able to red flags. Sudden personality change, salad speech, they call it salad speech. You should think stroke, hypoxia. Look at other signs and symptoms of stroke. Test them for stroke, or is it just oxygenation? How's their auto saturations? How's their color? How's their skin color? Are they warm? Is anything happening there? Then pupils, check if pupils are equal, round, and reacting to light. And you have to know the size. Any unequal pupils, any non-reactive pupils, any sudden change in pupils, that's a red flag. You have to act on it. You have to think stroke. Then you also ask them to squeeze your hands. Are they able to do that? You can put your hands on their feet and ask them to push. Are they able to push that? Are they able to put their feet? Are they able to lift their arms? Or are they unable? They will lift their arms but they will drift. All those things you have to be able to react immediately. And you're also assessing for, whenever you're doing that, you're assessing for strength, you're assessing for symmetry. Are they able to do things in both hands or just in one hand? Or are they able to follow commands? You've done the Glasgow Coma Scale, and mostly Glasgow Coma Scale has been emphasized for a long time while we're in training school. So most of us, we are able to understand the Glasgow Coma Scale. So are they able to move all extremity? I've talked about that. Then red flags, one-sided weakness, inability to move or drift in their arms. You're thinking now stroke. Are they able to sensory touch? You touch them on the face or their hands or there. Are they able to perceive touch the same? Is it equal both sides? Is it light? Whatever you do, are they able to feel it, or is there any deficits? Red flags, numbness, tingling, or loss of sensation. So you're able to do all these things, and this will be a focused neuro assessment. Call provider immediately and rapid response if you see sudden confusion, new weakness, slurred speech, unequal pupils, or loss of consciousness, or just anything different. And this you're going to do every day of your nursing, every day, whenever you come into contact. And just to shorten it, I said whenever you go into a patient's room, check for alertness, check for orientation, check for strength, check for anything that changed from the baseline. And with time, you're going to pick on these patients. And once you get here, your confidence will build. Once you are confident in doing those assessments, and people are able to trust your assessment. And I can tell you there's a situation where, depending on your background, some situations, the doctors won't trust any nurse's assessment. But I've come to understand that here they'll ask you, when they're assessing you, they'll come to the primary nurse and ask you, what was your finding? They'll say, hey, excuse Mary, what was your finding? Was this patient alert when you entered there? Were they able to understand you? Were they confused? And if you didn't do any of your assessment, they won't be able to trust your assessment next time. Because whatever interaction you have had with the patient, that's a base. The nurses usually set bases that even when the doctors, when they do their own assessment, they are going to compare to what you said. So foreignness, you're important. You can do this. You can be part of the solution to the patient's recovery. And hey, just get there. You can do it. And I'm here to help you with any need that you have. So if you haven't yet subscribed, please go ahead and subscribe.